Welcome back to Green Lifestyle. Have you been taking care of your feet? I know it sounds weird, but your feet do say a lot about the state of your health overall. Even the state of specific organs. Let's talk about 9 ways your feet tell you your liver's in trouble. What do the red dots say? How about cracked heels? We're talking all that and more. Number 1. Spider veins. Spider veins are often a sign of liver disease. Also known as spider nevus, these are small, dilated blood vessels clustered together on the surface of your skin. If spider veins appear on your feet, there's likely something wrong with your liver. People with an unhealthy liver often experience unhealthy blood vessels. Spider veins will also occur when there's too much estrogen in your system. There are 2 instances where this will happen. Liver damage or pregnancy. You are more likely to develop spider veins if you're suffering from cirrhosis of the liver. This is usually brought on by alcohol abuse. Just to make things clear, your liver is responsible for a lot of important tasks. These include detoxifying the blood, helping to digest food and producing proteins that help the blood to clot. If you notice spider veins in your feet, or anywhere for that matter, it's best to see a doctor ASAP. Number 2. Itching. Do you ever feel strange irritation in and around your feet? Do you feel that you're constantly scratching the bottom of your feet? Believe it or not, this may be another sign that your liver is in trouble. Itching of the skin, also known as pruritus, could mean that there's a buildup of fluids in the liver. The organ is congested, causing sensitive areas of the body to become irritated. From here, you'll usually notice irritation in the palms of your hands or soles of your feet. Studies have found that most people suffering from a chronic liver disease will deal with some sort of itching. It's especially common in those with primary biliary cirrhosis, or PBC. Roughly 70% of those with PBC will experience itching of the skin. Mind you, this symptom is not as common as the ones we're about to talk about. Number 3. Red dots. Have you been noticing redness in your skin? Not just rashes, but strange, tiny red dots. This is another sign that liver damage may have taken place and is affecting your body. Red dots on the lower leg can indicate liver damage, as well as diabetes. When a person has diabetes, skin problems will occur. You'll start seeing tiny red dots pop up around your ankle area. This is because your blood circulation is off. The heart isn't properly able to send blood down to the lower part of your body. Aside from the red dots, diabetes can also lead to heart disease, stroke, and kidney problems. Its attachment to the liver is through its increase in the risk of non-fatty liver disease. This is where an excess of fat will build up in the liver, even if you stay away from alcohol. It happens with at least half of the people diagnosed with type 2 diabetes. The poor circulation happening during this time will result in the red dots. Number 4. Pain. Are you going through undeniable pain every time you walk? Are your feet hurting even when you're sitting down? Liver disease will cause you to feel terrible pain in your feet. It sometimes gets to the point where you can't even walk properly. Well, this can normally mean hepatitis C. Hepatitis is the most common cause of liver disease. With Hep C, a person can suffer from a mild illness or a serious, long-term sickness. It can often lead to cirrhosis, liver failure, cancer, and even death. Anytime the liver has been damaged from disease, you'll feel a strong pain in your feet and ankles. Number 5. Swelling. Along with your foot pain, you'll also notice your feet starting to swell. This is known as edema. With edema, areas of your body will see a buildup of fluid. It usually happens in the feet, ankles, and legs. You can sometimes even press your finger against your foot and see a small dent left in your skin. This is known as pitting edema, and indicates a buildup of excess fluid. Hepatitis C can lead to something known as Raynaud's phenomenon. This is an autoimmune disease affecting your toes, fingers, ears, and nose. When this happens, the small blood vessels in your feet and toes will overreact to the pressure brought on from cold temperatures. This results in a reaction that causes swelling along with severe pain. Number 6. Discoloration. This is where things can get really scary. As if spider veins didn't sound creepy enough. A liver problem can be shown through yellow discoloration on your feet. This is known as jaundice. Imagine waking up to see that your feet have changed color. This might be your body telling you that you have cirrhosis or hepatitis. You may also be suffering from liver failure. Let's talk about that for a second. Liver failure is when your liver has either lost all of its function, or is in the process of losing function. Aside from the obvious jaundice, other signs of liver failure include abdominal pain, vomiting, nausea, fatigue, and confusion. If you're experiencing all of these symptoms at once, it's best to see a doctor. Liver failure can be life-threatening. Number 7. Cracked skin. This probably isn't the first time you've heard of cracked skin. I mean, it's pretty common. Cracked and dry skin can point to several health conditions, including the lack of vitamins. If your body isn't receiving the proper nutrients, your skin will eventually look old and rough. In the case of your liver, you're likely missing omega-3 fatty acids. Supplements of omega-3 fatty acids have been shown to improve liver function. Studies have suggested that taking omega-3 supplements could be beneficial for people suffering from non-alcoholic fatty liver disease. Patients with omega-3 in their blood see improved function in their liver. One of the liver's main functions is to help your body absorb vitamins and nutrients. If you're missing vitamin B3 from your diet, your skin problem is probably going to be made worse. This vitamin works to prevent water loss and maintains your skin's moisture. Vitamin B3 will reduce wrinkles and smooth out the skin's surface. So if you find your foot looking cracked and miserable, I would start getting more vitamins and nutrients into my body. You can get omega-3 in different kinds of seafood and nuts. As for vitamin B3, you can get it by consuming more meat. This includes chicken breast, tuna, and turkey. Number 8. Odor. This is one of the things we've all experienced at one point or another. Foot odor can be caused by many different things. This includes your liver's inability to detoxify. When the organ can't detoxify correctly, it forces your body to do so through the skin. This is especially common in people with poor eating and drinking habits. When you have a poor diet, the body in general will emit a foul odor. The digestive system is backed up with a lot of toxic, fatty foods. And because your organs are not working to process them, they're coming out through the skin. This can also make your breath and urine smell. But if you notice your feet are smelling worse than usual, you might want to switch up your menu. Number 9. Burning sensation. Have you ever felt like your feet are hot? Even when standing on a cooler surface, this can be a sign of a fatty liver. When a part of your body is infected, inflammation will occur as a way for your body to fight off the infection. When your liver becomes inflamed, you may also be able to feel it throughout your body. One of the signs is a burning sensation in your feet. This is your body sending signals that something is wrong. Although some people don't feel anything at all. But the health of your feet is really just the beginning. You now have to improve your liver. To get rid of your fatty liver, try losing some weight through exercise and calorie counting. Have you been taking care of your liver? Let us know in the comments section below. Hit the like button and share with your friends. Also, subscribe to our channel for more videos like this. Thanks for watching.